Mike, your area is research, and as I said in my notes, you're one of the most not only prolific health literacy researchers, but one of the most collaborative. Anytime Mike meets somebody that's doing a similar thing, all of a sudden they're writing a grant together, writing a paper together. So you sort of are connected to most people, not only in the country, but all over the place. But I wanted to preface my first question. Sometimes I think as a health literacy researcher myself, that we've lost our creative spark. And for me, it's like, how do you get funding and how do you sustain funding, rather than thinking about what the problems are and what are meaningful ways to address those, and can we measure them to see if it makes a difference. So, you know, do you see that is that just my opinion, or have we lost a little bit of our spark? And are we so focused on funding? And how do you think we get that spark back?
Yes.
So go ahead.
I just saw the time card and was trying to be helpful. No, I mean, I think it's a really great question. I kind of appreciate the feeling that there's a little bit of a stagnant nature in the research, and I think that also, actually, I don't know if anybody else had heard the 3-part NPR series on basically the broken system of biomedical research in the U.S. It was so depressing, I had to turn it off, and avoid the article that we do live off of research. We are creating kind of this very challenging environment where you have a lot of people focused on the dollars and where the pay lines are, and how the research fits into the larger agenda, throughout DHHS, and that you kind of lose your sense of creativity and thinking about what would you really want to do, and you just think of the boundaries of both the research agenda that's put forth to you, but also the limits of our healthcare system. I think put a great amount of constraint as to what we think we can do, because we take a very pragmatic approach. And I think Rima made a comment earlier about, there are lots of reasons that Michael Pasciarello pointed out too, about what is a really difficult challenge in changing professional education, not only not having the research dollars for it really, or an interest in putting research dollars towards it, but also in what's a realistic goal versus what we should still kind of press on and go forward. So I think that, I think what we really need is to figure out a way to better inform and think about how to, what we want out of this existing program. I'm going to be very on the ground level for a second. We've had one of the most wonderful things happen to us, and I think it was in 2004. I'm looking at Marin. Was it 2004 that the program announcement research first came out? And we're now looking 10 years into it. So in 2024, will we still have a program announcement throughout NIH that at least originally had many institutes in ARC as well attached to it, and had a special emphasis panel to really protect the research and to give us kind of a very consolidated agenda. I mean, it was really one of those beautiful things you could have possibly gotten. So I think there's a really big applause to be given for just the people in the room here, and that are not in the room right here, for making that happen. I mean, without it, I think we would have not nearly be where we are. The problem has been, I think, that we've lost steam. And I remember one of my own program officers, attached to a particular institute, which I won't name, was very sympathetic and kept asking me, you need to tell me more about what you're doing, because a lot of people in my agency don't really want to buy into this program announcement. And that was earlier on. So I think the sell still exists to have to recognize it. As a researcher, it makes me very skeptical and confused and concerned about more institutes kind of maybe not opting into it. So you then focus your research. I mean, I think the glass half full perspective has been that the one great thing about health literacy, whether it's a movement or a field of study, how it fits in to other pieces, it's a chameleon of research, that it can fit in. I was talking to Cindy at the break, I think that it, in many ways, I view in myself, the worldview of health literacy for me is that it's kind of a core piece that has kind of, it tentacles into many other things, and like the Russian doll kind of analogy, that it sits within healthcare equity as kind of where it really fits in disparities, that it's a disparity that we discovered very first, but it is absolutely a quality component as well as a safety component, and you can think of it across any context that's a current event. I mean, whether it's the Affordable Care Act, where it's just so obviously at play, to thinking about issues around aging and other really major topics that, whether it's a special population or a medical context or a system issue, it's so easy to shape it and show that how it fits into that agenda. So that's the benefit of it. The challenge then becomes, though, is it its own field of study? And I think a lot of us still are confused as to what we're talking about, although we really shouldn't be.
So no, that leads me to my next question. So as you're envisioning 2024, so you'll be, how old will you be in 2024? You will be.
Benjamin Button, I'm going in reverse.
I'm telling you, your 50s are great. So you'll be in your 50s, which is great from my perspective. And so is health literacy going to be a field of research? Is it going to be absorbed by or a component of other things? We've heard many other things. Really, how do you see it?
Yeah, she's privy to my age, too, because I met her on my very first day of a postdoc 16 years ago. So, yeah, I think, so I honestly think if I were to be, in a very explicit view, I would think that what's going to happen is that in the near term, in the next, instead of thinking 10 years, thinking the next 3 or 4 years, we're going to continue this kind of cycle of kind of myopic focus on condition to condition and showing how health literacy is associated with it. And I think the one benefit that's been pretty interesting is that more and more research studies that I read and grants that I review and whatnot, whether that someone is a health literacy researcher, or whatever that takes to be certified for that, whatever, they are including it as a covariate in a model to study it as an additional determinant of health that could be a risk factor. And again, that in terms of what we call a skills-based issue in terms of an individual difference. And I think that's also important that they're measuring it, because then they can be looking to see if anything they're doing is mitigating or reducing any disparity to that regard, something that Ann Beal called a long time ago. That may continue on and may continue to grow as people accept that this factor is something that could determine an outcome. Whether or not we can find a way, and this is the challenge, I think, to the field, is can we find a way to turn the canon away from individual skills to something that does provide, not just process measures of a health system's adoption of evidence-based practices, but I think this point was brought out at the panel this morning. Do we have metrics for understanding whether or not those evidence-based practices, which again, can be variable in terms, do they actually push the needle on outcomes? We do not have the business case, and I've talked to Dr. Isham many times about this for quite a while on these panels. How do you get the business case for a health system to say, I do want to do this, I do want to adopt one of these toolkits, or I do want to start making these changes when you don't have a mandate in front of you? So research that really starts to understand implementation of these things, it just may not have a label of health literacy. I hope it does. I think it means that we have to start to consolidate and start looking, maybe as a movement, how other fields of study are doing health literacy research, not just us in this room, because everybody's got, I think, a major skin in the game on it.
So do you see some of the research shifting to trying to evaluate corporations, healthcare systems, rather than, are we moving the needle on whatever, cancer screening or diabetes or whatever?
I think you're going to, well, I think, again, I position myself as I'm a health services researcher who sits within a school of medicine, so my perspective is oftentimes not from a public health perspective per se, but like thinking of how do you change or redesign a clinic workflow or a practice or a health system attribute to improve care and engagement of patients. And I think, so if there's a lot of interventions that are focused on that, I think that is a direction we're going, and we have to understand then not just we did this and it improved, outcomes, but understanding, and this is what I really like about the field of implementation science, which is again another field that many people might think, well, I was kind of doing that already. It's actually much more than that, but to really understand how do you, how hard was it to make those changes? I mean, I think health literacy has given us a very pragmatic, a very touchable kind of research agenda that I think in some ways is the reason why so many people love this. It's one of the best branded research agendas I've ever encountered, and it's so malleable, and it also allows people to really kind of grasp, I totally get it, the complexity, the need to simplify. That's been something that I think people capture. It's just understanding how to disseminate that, whatever you do, and I think, so there's a lot of research agendas. One, find something that's effective at helping patients, all patients, and understanding those that represent a disparity, but also in figuring out, well, how do you do it, and how do you disseminate it, again, in lieu of no mandates to, like unlike in the UK or in Europe, where they have some mandates for patient testing and improved communications, and where we lack them, I think it's important.
So my last question to you is very concrete. Where are we going to get the money? Is it foundations, corporations, venture capital? I mean, people in my institution are looking at all kinds of things. I mean, I'm not developing drugs, so venture capital is not coming to my door, but...
So I think whether or not there's a field is dependent on whether or not we continue to have the protections, I think, of a special emphasis panel, of a program announcement to really drive this research, which again allows us all to kind of consolidate on it. And I think that again, I would almost make the argument that we need to almost a booster shot to re-engage the existing panel, because one of the other things I'm just going to be honest about, this current panel is a little bit is concerning right now because it's shrinking. Its membership's shrinking. It has not had a lot of the people who I think understand the concept as well, maybe engaged in it to the degree. We really need to understand that a little bit better. But to keep that protections in place and to have more institutes maybe rethink and for us to quantify the value of the work that they've funded over the years is going to be really important. I think industry, which causes a lot of problems for academic researchers, where there are opportunity, but there's this kind of age-old kind of conflict that we shouldn't engage, that there's conflict, that it creates biases and issues. But at the same time, it's industry that is putting out, whether it's a medical device or some other product, to patients where they do see the benefit, and they're also adding, or they can remove some of the complexity directly to the consumer. So I think they definitely need to be involved, and we need to reconcile how we work with industry on that regard. Because this field in particular, I remember the former president of the IOM had made a very big comment to this, that this might be a great place to go to for this type of research. We've heard this a lot. I think foundations, and obviously that's great to have foundations and to have specific groups like American Cancer Society, ADA, and others engaged on it. I don't know how well they've been tapped into it, so maybe reaching out to them further. But again, it's always going to be, PCORI needs to get over a 2019 hurdle for it to really stick. It's already kind of on its tapered way down in terms of its peaking with extramural funding already out there, even though it's still sizable, and it's really perfect for intervention research here. But NIH, anything, ARC, NIH, CDC, HRSA, all the DHS entities really have to be our bread and butter for driving the research agenda.
That's so cool that in this room you have federal agencies, you have corporations, and foundations. So they heard you, I guess, huh? Winston.